Question 45. Sorry, true about GI contrast studies. Foil spring appearance seen in interception on anterograde study. Question 46. Female patient comes for CT abdomen. Did you compare abdominal pain and sweating? Um, compare abdominal pain and sweating. She developed headache, palpitation, and rate BP 180 by 110 and about 15 minutes after contrast CT. This could have been prevented by giving which of the following before CGT alpha blockers. ठीक है question 46 पे alpha blockers. Question number 47. According to new ACR guidelines, use of metformin should be stopped till 48 hours after CGT of a parent having normal creatinine or renal function when metformin is to be stopped from the time of contrast administration to the morning of CGT. 47. Okay, remember that when patient uh, is planning CGT contrast and HCT account, then metformin and having normal creatinine, then metformin should be stopped from the time of contrast administration on the morning of CGT. And after abnormal creatinine renal failure, then it should be stopped 48 hours before administration of CGT and started 48 hours after CGT. But when the MCQ comes, you will see now when using metformin and having normal creatinine, normal renal function, then metformin is to be stopped from the time of contrast administration on the morning of CGT. This is written over here on the side. Get okay. Rib notching. Superior rib notching causes endocrine disorders, hyperparathyroidism, Marfan syndrome, NF1, and collagen vascular disease disorder. And inferior rib notching causes are heart-related disorders like coronary heart and subclavian syndrome. 48. Regarding 12 contrast media, LOCM can be used to describe the level of tracheoesophageal fistula. Dual osmolar contrast media can be used to describe the level of tracheoesophageal fistula. 49. For which of the following coordinated stomach is most common site? Non-Hodgkin lymphoma. 50. Regarding unibladder cancer staging, not correct is CD can differentiate stage 1 and 3 effectively. Okay, now not correct is CD cannot differentiate between stage 1 and stage 3 effectively. Then other MCQs regarding bladder scan staining is 25% on both readers, 60% CIS. On C2, 30 to 50% more common, 2 to 4% renal pellets or reader. 50, 51 posterior on imaging, zone not on posterior is well appreciated on T2 images. Posterior on imaging, zone anatomy of posterior is well appreciated on T2 images. 52, which was one complication commonly associated with renal transplant, gastric ulcer. Commonly associated with renal transplant, gastric ulcer. 53, a HRCT in a smoker shows multiple cysts and central global nodules with basal sparing, with light network and enhanced with cytosis. HRCT in smoker shows multiple cysts, and central global nodules, basal sparing, light network and enhanced with cytosis. हेलो आपको आवाज आ रही है? हेलो
ये सर आ रही है।
अच्छा, इसमें ये ना कि ये सारे याद करना है, ठीक है? एक एक पेज पढ़ के या फिर जुबानी आपने आपको सुनाना है, ये टाइम रीड करना है और ये आंसर याद करना है। ये सारे इस तरह MCQs है और कोई दूसरा आसान तरीका नहीं है, ठीक है? और बंदे को समझ में भी आ जाए, लेकिन पेपर में तुम्हारे पास सिर्फ 30 सेकंड होते हैं या 40 सेकंड होते हैं MCQ आंसर देने के लिए, तुम्हें स्टेम देख पढ़ के याद करना है कि ये आंसर है बस, और ये सारे ठीक आंसर है, सब चेक है। 54. Scenario on L1 anti-trapping dependency from our books. Young patient bully formation in all lower zones. 55. Scenario of lymphangitis tosa unilateral breast cancer interlobular septal. In lymphangitis tosa has interlobular septal thickening with nodular interlobular septal thickening. 54. 56. Scenario of young patient with fever and hemoptysis showing central cystic pancreatitis with fluid level plus recurrent infection, cystic fibrosis. Recurrent infection and then hemoptysis and central pancreatitis, cystic fibrosis. 57. Recurring acute allergic extended alveolitis, chest acne can be normal in more than 50% of patients. 58. Meconium aspiration syndrome. multifocal, glossy, patchy, opacity only. Uh, Meconium aspirations syndrome, multifocal, glossy, patchy, opacity only. 59 presence of air bongogram excludes, resorption collapse. 60 esophagus stricture in presence of preflight communist and Barrett esophagus. Great. Esophagus stricture in presence of preflight communist and Barrett esophagus. 61 prominent main left pulmonary artery seen in pulmonary stenosis due to jets. In pulmonary stenosis, there is partial stenosis of pulmonary artery, but prominent pulmonary artery left pulmonary is due to jets of blood. It causes prominent pulmonary artery. 62 Schmidt sign is seen in PAPVR, partial anomalous pulmonary redness return. 63 which condition is more commonly associated with congenital anomalies in 20% of cases? Extralobar sequestration. 64 scenario of Down syndrome, antenna sound, short femur, increased nutrient deficiency, duodenal atresia, increased alpha-fetoprotein. 65 canary disease in child with pulmonary plethora, transmission of great arteries. Now, heart disease, congenital heart disease are classified into acanthonic heart disease and canonic heart disease. Canonic heart disease are 5 T's: TOF, trichotropia, transmission of great arteries, TAPVR, Epstein, trichobiatresia, and acanthonic heart disease are left-right shunt and aortic obstruction. Left-right shunt are ESD, VSD, PDA. And aortic obstruction is pulmonary stenosis, aortic stenosis, and carotid aorta. Now, pulmonary plethora are seen in all except pulmonary oligemia seen in tetralogy parrot, pulmonary stenosis, and Epstein anomaly. They all show pulmonary oligemia. Rest all of them show pulmonary plethora. Now, 56. Hoffman regular sign indicates enlargement of left ventricle. Hoffman regular sign indicates enlargement of left ventricle. 67. Most radiopaque calculi are oxalate. Radiopaque calculi are oxalate. 68. Intervertebral disc calcification period of calcium monophosphate deposition disease. 69. 10-year-old male presents with precox puberty and seizures. Which of the following is the most useful investigation you advise to read the diagnosis? Plain and contrast MRI brain to see for tuberous sclerosis. 10-year-old man with precox puberty and seizures. Which of the following is the most useful investigation you advise to read the diagnosis? Plain and contrast MRI brain. Now, these are about sensitivity and specificity, but important IMM is not important. Part 2. 70. 9-year-old female patient underwent intense CT scan of abdomen and pelvis for checking of ovarian cancer. She showed disease limited to pelvis, however, the ovarian mass was inseparable from the uterus. Clear flat pain between the mass, bladder, and rectum seen. What is the state of tumor count to fecal system? Stage 2, 2A. Stage 2A is the fecal. Okay, now, how is it? Fecal ovarian cancer, fecal staging. Stage 1, growth limited to one ovary. Stage 2, involving one or both ovaries with pelvic extension. 2A extends to ureters or tubes. So it inseparated from uterus, so the mass has extended to the uterus, so it's 2A. 71 only lymph nodal involvement on chest X-ray and sarcoidosis scenario, which is the stage? Stage 1. 0 is normal, stage 0 is normal, stage 1 lymph node involvement, stage 2 is parenchyma plus lymph node involvement. 72. Regarding derived feature of fungal infection of bone, vertebral body structure and preserved intervertebral disc. Regarding feature of fungal infection of bone, vertebral body structure, with preservation preserved intervertebral disc. 73. Sentinel clot sign at duodenum seen in blunt trauma. Sentinel clot sign at duodenum seen in blunt trauma. 74. Worm infestation causing soft tissue calcification. Names of worms: Dracunculiasis. Worm infestation causing soft tissue calcification. So remember the name of all the worms is Dracunculiasis. 75. Ascariasis is associated with bowel perforation. 76. Computer operator bilateral ptosis grouping of ion straining. Lab shows rectal aplasia. CT test will show anterior mass. There is thymoma. Thymoma is associated with rectal aplasia. 77. Incidence of VSCT among congenital heart disease is 36%. VSD is 70%. VSD is 36%. Remember like this that VSD, so V, if you put it, okay, but 36%, VSD 36%, ASD 70%. The 78 characteristic feature of renal tubercular closes include six-shot calyx with dilatated calyx. 39 post-traumatic arteriovenous dural fistula, most diagnostic imaging modality of post-craniotomy arteriovenous malformation, most diagnostic imaging modality is intra-arterial angiography. Thus, fistula or post-traumatic arteriovenous fistula diagnostic modality is intra-arterial angiography. 80. Pregnant female with 7th week of gestational amenorrhea, what is best parameter for gestational age? CRL. 81. Mean sac diameter that embryo should be visible normally to 12 to 20 mm. Mean sac diameter is 25 mm, but closest to 25 mm answer is 20 mm. So 12 to 20 mm is the mean sac diameter. 82. In MR spectroscopy, resonating frequency is measured in units of parts per million. 83. Scenario of enteropyly cholecystoduodenal fistula. CT appearance of duodenum gallbladder at fistula is contracted small gallbladder adherent with the duodenum appearing as a diverticulum. 84. Scenario of congenital hypertrophic pyloric stenosis. What is typical feature? Pyloric canal length greater than 17 mm and wall thickness. 85. Contrast in lymph nodes can remain for a period of 2 years. 86. Thoracic aortic aneurysm greater than 5 mm. 87. Scenario of Coats disease, leukocoria. No calcification is seen in Coats disease and retinoblastoma shows calcification. 88. Most common salivary gland tumor in pediatric age group is mucopolysaccharidosis carcinoma. In adults is Wharton tumor. 89. Salivary gland tumor containing multiple not mixed tissue components is mixed. 89. Mixed. Sorry, Wharton tumor. Salivary gland tumor containing multiple tissue components is called Wharton tumor. It all are seen in adults. Now here, when they say multiple tissue components, so it means Wharton tumor, that is multiple tissue components. It does not mean mixed. It means multiple tissue components seen in Wharton tumor. 90. Malignant mass involving bilateral parotid glands, lymphoma. Wharton tumor is benign, so involving bilateral parotid glands is lymphoma. 91. Calcification is seen on plain X-ray in 50% case of neuroblastoma. 92. 45-year-old female with eyes returned to gray matter on T1 and T2 seen in the posterior horn of ventricle with herniation of layered meningioma. Eyes returns to gray matter on T1 T2 and posterior horn of ventricles meningioma. 93. Scenario in the trigon of ventricles in meningioma. 93. Scenario 5-year-old child presenting with ear mass intact membrane was diagnosed with congenital cholecystoma. 94. Indicator of electrography, blood stained, unilateral blood stain discharge. Electrography indication, unilateral blood stain discharge. 95. Which of the following is incorrect regarding scintigraphy? Renal activity and excretion are similar in normal and obstructed kidneys. Incorrect regarding scintigraphy, renal activity and excretion are similar in normal and obstructed kidneys. 90. Question number 1, next paper. An old man presented with shortness of breath. CT X-ray shows